Hello, welcome to the Trauma Safe Lab. When I originally got on the call with Dr. Johanna Lynch, I thought I was fully prepared to discuss this topic, and the kids were awake, which I thought was fine. They were doing their thing, but I quickly realized that the topic of safety was way too overwhelming for me, and that I was not even able to think of the kids. I was dissociated, and so I had to move the kids to another room, which again was fine. My in-laws were there, and when I just did the review of that episode, I was really shocked because I do not remember any of it. And I remember when I got done the recording, I had messaged her and I apologized profusely because I thought we only had recorded a few minutes and that my kids were in the video the whole time. I mean, I was just completely disoriented and not correct, thankfully, because we have almost 60 minutes of talking, but the way I internalized it and the way I reached out to Dr. Johanna was with the idea that we didn't get enough recorded, or that I was too distracted to be dissociated to be in the conversation for it to be meaningful. And I was wrong. I mean, you'll hear it. She carried the whole conversation like a champ, and listening to it now was even hard for me. In the safety of my home, and I'm calm and regulated, but I feel myself getting dysregulated and dissociating. But I was able to tolerate it and stay present. So this is one episode I feel a little bit compelled to maybe even give a trigger warning. She doesn't go into any details. There's nothing, maybe it's just my trigger warning that I was triggered, and the sense of safety I didn't know was so triggering for me. So there's no details that you need to avoid or stories that you don't want to hear. It's not that kind of a trigger warning. It's more of this might hit you a little bit harder than you thought. And if it doesn't, great. And if it does, I'm just giving you a heads up, it did for me too. And I'm also going to have to listen to this episode a few times just to work through what was making me dissociate. Thanks for listening to the Trauma Safe Lab. I hope you enjoy this episode. I'm glad that I can present it to you. Hello, welcome to the Trauma Safe Lab. Today we have a special guest. We are going to interview Dr. Johanna Lynch. She is in Australia. Today we're going to talk about the sensing safety, how physical and emotional security transforms trauma care. And the topic is creating environments of safety, the foundation of whole person healing.
Thanks so much for having me.
What we talk about a lot in trauma is what I call the trifecta, the power, feelings like personal agency, safety, and trust. So you're definitely covering that one strong base that we need in trauma. So I'm excited to get into it. Dr. Johanna Lynch is an accomplished family physician, author, and founder of Australia's first transdisciplinary trauma clinic. Her journey from Uganda to Australia as a refugee has shaped her approach to healing. She's the author of A Whole Person Approach to Well-Being, Building Sense of Safety, and creator of the transformative Sense of Safety for Practitioners Foundation course.
We're in this together. I would say my framework is not just about the environment being safe, but that inside we sense that we're safe, and that's part of the healing. So that almost like the goal, I would say the goal of trauma therapy is to help people sense that they're safe, so that they're safe enough to do the next few phases, which are remembrance and mourning and reconnecting to ordinary life, what I call safe enough to grieve, safe enough to grow.
Safe enough to grieve, safe enough to grow. I don't know why, but even just hearing you say that, I feel like I was replaying my whole life rapidly, and that makes total sense.
And what I wish for is that all healthcare clinicians and teachers and educators would know that helping someone to sense that they're safe is the main thing we can do.
Yeah.
Take a couple of your own breaths. Remember where you are. Notice where your feet are, where your hands are, where your shoulders are.
Yeah, sometimes this happens with the anxiety, and I actually just leave it in, usually, depending, because it's good for people to see and hear this too.
Yeah, absolutely.
You also have a very calming voice for this.
Some parts of my family would not agree when I speak. I do get that every now and then. I think, although one time I was employed to speak on a movie thing, and they had to replace me because my voice was not the right sound for what they were doing.
Uh,
Yeah, it's not
oh,
it's not
that's funny.
good for
I think
everything.
that's come up then as a topic frequently.
And it's interesting because, as you know, I've lived in many different cultures, and so my accent has changed. And over the years, I used to just dismiss that. That's just a funny, like, quirky thing about moving from one place to the other, is that I learned how to mimic and how to fit in by shifting my accent. But actually, over time, I realized that our accent is such an intimate part of us. And
Yes.
to have it be something that marks you as an outsider is such a painful thing, actually, and that it's an injury that has happened over the years to me in different phases of my life.
Mm.
So to be so aware that our voice and how it's heard and how we perceive it can be such a sensitive thing about who we are and about how we feel safe in the world.
Oh, and then basically how we intro this podcast is talking about how I like your voice. So that's great.
Yeah, thank you.
Yeah, that always works. But I do know what you mean about the voice because I lived in New York for 10 years. And long story short, I went to an acting thing, right? A trial, whatever. And the speech coach said, well, you're going to have to do like speech, like training or whatever she called it. And I was like, what do you mean? She was like, for your accent. I'm like, I grew up in Philadelphia. It's literally 80 miles, right? Like 100 kilometers or whatever from New York. I mean, we're neighboring.
Yeah.
And then I started crying, which I didn't even think I cared. But then I realized it connects me to my mother who passed away. And it's like she's trying to tell me to lose that connection with my mother.
Yeah.
So your voice and your accent, you're right. It can be a sign of safety. It can be a remembrance of a vulnerability for trauma, creates you as an outsider. So that makes you vulnerable.
Yeah, and I think also when we think of ourselves with other people, our voice communicates kindness or not. And they talk about prosody, the kind of playful ups and downs of our voice when we're feeling relaxed, and the way that changes when we're feeling frightened or terrified. So even when we think about parenting, there's a group who researching parenting under pressure, and how the normal ways of connecting between a parent and a child can be affected when you're feeling fear or overwhelmed or stressed as a parent, so that your voice can't do these natural ups and downs and reflecting and tuning in and responding to the baby or the infant as needed. Yeah, so
Yeah,
that.
because earlier when I was trying to like see if I could manage it, in the back of my mind, I'm like F up, right? But then I'm like, that won't be helpful for any of us. And like, this is my problem, not their problem, right? So it's
Yeah.
like always sometimes hard, like what words to choose because those same words might not be like safe to say in that moment because of the way it would come out. So it's funny that we're talking about this because you're giving me clarity on a lot of things because I have to pick different words to make sure that I can keep my tone a certain way so that they can not feel, well, my goal or my hope is that I could keep them calmer, right?
Yeah. Yeah. So, and I think, that then says about, for us as parents to acknowledge that when we're under pressure, that's not our fault if we can't get our voice right for our children. To acknowledge it does impact them. And so therefore looking after our own inner stresses and not just trying to function like looking normal on the outside, is
Oh, yeah.
deep healing. Deep healing goes a couple of generations long if you're parenting.
When you have to talk a bit, like about safety with practitioners and building a sense of safety, there's a definition in your mind that you have that might be different than somebody else, and also not pathologizing it, right? Not needing to label, and then make it strength based so that people can not be stuck in the anxiety and they can move out of it and reframe it if possible.
Yeah, so I got your question thinking about, how can we be non-pathologizing when we talk about this topic? And I do think one way is to be really clear about where we're going when we heal. If we don't have a clear sense of what healing looks like, it's really hard not to fall back into looking at what is wrong and trying to work from there. Whereas if we know where we're going, then we can point our attention towards where we're going. And I teach a lot of family doctors, and I talk about pattern recognition of strengths. And that they do that without even knowing they're doing it. And I use the example of a normal blood pressure. So a normal blood pressure is like a physical strength. It's where it should be. It's regulatory. It's beautiful, rhythmic. It's incredible, a normal blood pressure, really. And we use that pattern of what is a normal blood pressure to help us pick up all sorts of changes from that normal blood pressure. A small change up or down, or a big change up or down, with always the goal of knowing where we're going back to when healing happens. Yeah, and I think, unfortunately, in the mental well-being, whole person well-being space, there's been a hesitancy to name what well-being looks like, what health looks like. And I think partly that is because early descriptions, with were a little bit value-based and culture-specific, and so people were hesitant to impose their way of seeing what well-being was. But I genuinely think that we could all agree that sensing that we are safe would be something we could all agree to as a name for what well-being looks like. And by sensing we're safe, I mean sensing we're safe across our whole being. So safe in our environment, so that the politics and the policing and the housing and the finances and the experiences of being marginalized and those sorts of things are not there. And we sense that we're safe, and safe enough to be is what I would say about that. And then the next layer in is our social climate. So that's where we live and where we learn and where we work, and also online. So these are spaces where we may not have personal relationships, but there's relationships around us. That's culture and words and stories and images and ways of being and managing power, and some structural things that are historic are in that space as well. Racism is in that space, and some of the gender-based rules and regulations about our roles and who we are meant to be according to somebody else are in those spaces. And one First Nations Aboriginal academic talked to me about being a child in a home where stories were told about her people being taken away in what we call stolen generation here, where children were taken away. And so as a child, she didn't have personal relationships with those people, but she had fear that came because of hearing the stories. And so for us to be really aware of the atmosphere in those spaces where we live and learn and work, what amount of hope is there? How much ways of coping, or what range of ways have we got to cope? Or is there really very narrow, addictive, or sort of avoidant ways of being that are kind of modeled all around us, and we don't have a kind of pathway to anything different to that around us? And then the next layer of sense of safety is in our personal relationships. So who's there? Who's missing? And what is the quality of those relationships? And people describe in my work somebody who's available, tuned into me, and on my side. And I add the kind of word affection, that we want people who are genuinely affectionate towards us, not judging us, excluding us, ignoring us, dominating us, controlling us, all those kinds of things. And instead having these experiences of belonging safely and connecting. So I call that safe enough to connect. So the three kind of outer layers of safety are safe enough to be, safe enough to belong, and safe enough to connect in our personal relationships. And then I go in from the body and into our inner life, which I'm happy to talk about now, or wait till whatever you would like to talk about.
Yeah, let's hold back a little bit, create some tension. While you were talking, what came in my mind, I always like to find common denominators if I can in categories, because, my brain creates lots of files and categories. So what I think maybe it has been the game changer recently is focus on the nervous system versus, because that's objective, especially with things like wearables, right? Where you can track the HRV, the heart rate variability and stuff. And so I think even for the sense of safety, having to define it and then be culturally and gender and racial cognizant, those things can be different because they mean different things in different places and different times. But what remains constant is the nervous system, or not constant in my situation. So
Yeah.
I'm going to think about what you said through that lens.
Yeah, and look, I have been thinking about that, my work through that lens too. Sort of halfway through my doctoral work, I came across the work of Stephen Porges, who's done some very deep thinking about how our nervous system is on. And I'm now getting to influence medical curriculum design, where I talk a lot about the autonomic nervous system, because unfortunately we don't notice invisible things as much as we notice visible things. And the autonomic nervous system is in effect an invisible part of our sensory experience. He has coined the term neuroception. And I also reference the generalized unsafety theory of stress. I think it's Brashot's work, and in that it talks about how as infants we basically have a default experience of not feeling safe, and we need signals of safety to reassure our nervous system over and over. And so this helps us to understand previously ununderstandable experiences of ill health, where you didn't have a really visible event that happened that people might call traumatizing, and instead it's the absence of safety that has been the injury to the nervous system and to the person's sense of who they are, connectedness and trust and all those beautiful things. So for me, at one point I'd love for us to have a little bit of an unpacking of the word trauma when we talk as well, and I'll wait for you to choose the right time for that. But I think that's part of this.
Let's define it. Yeah, I love it because it's good. We need to hear it. You see it so the rest of it can make sense.
Yeah. Okay. So I think we use the language trauma in medicine in two very narrow ways. One is in the emergency room where we see blood and guts and the person's had their physical body injured in some way, invaded in some way. Or we use it in a psychiatric framework built on the history of the Diagnostic Statistical Manual. And its history really was very intentionally not having etiologies connected to symptom sets, but in the area of PTSD, it did create an etiology link, and a very narrow one, which I would say was defined for insurance and legal reasons rather than healing reasons. And so that definition was really to decrease the number of payouts due to people who'd gone to the Vietnam War, and they had to have seen something life-threatening or been a victim of something life-threatening. Since then, the DSM-5 has added sexual violence to that list. But again, a very, very narrow definition of what is traumatizing to a human being. And I think actually has caused immense harm. The number of my patients who've had senior psychiatric colleagues tell them they weren't traumatized because it didn't fit into that category, I've lost count of. And I myself had a really deep learning about this, which I mentioned in my book, by an older lady coming into my rooms for healing work. Her flashback she kept on receiving was to being stuck in the cupboard as a little girl playing hide and seek. And nobody was coming to find her. They'd given up looking, or they'd forgotten to look for her, and she couldn't get out on her own. She was stuck in there. And so for her, that was an experience where she now in her 70s was still getting flashbacks.
Wow.
And if we took that to somebody who was using DSM to diagnose whether or not you were traumatized, she would not qualify. But she was experiencing all the same things and re-experiencing the avoidance, etc., that we name inside the PTSD framework. So I guess my learning, I would now I speak about a very generalist view of what is traumatizing. And in fact, I'm more interested in what makes you lose sense of safety than rather than what we're naming that X and Y is traumatizing to you, and we have to name it and look into it and discover it. The other thing during my therapy time is that initially I thought my job was to listen to the stories of the trauma and be a witness and a co-walker through the journey of seeing the pain. Now I learn to look for the patterns of loss of sense of safety, and we actually don't need to know the whole story, don't need to relive it or retell it. And instead, we know where we're going. And again, that's that strength-based approach. We know we're walking towards more sense of safety, away from lost sense of safety. And that's the main things we need to understand.
My silence, I'm just sitting with this information.
Yeah, to me, it's very important that we stop needing to name, almost like somebody else outside of us gets to determine whether or not it was a bad thing. When actually, if we go back to the original Greek meaning of the word trauma, it means wound. And wounds are what we experience. Somebody else doesn't get to tell us if we were wounded, and it's an internal process. The other people that I go to for understanding trauma are those who work with healing. So there are some frameworks around it being too much for our usual coping mechanisms. That comes from the work of Louis Cozolino and John Allen, who works in psychotherapy and mentalizing kind of healing. He talks about it being left psychologically alone with unbearable pain. And so for me, often if we use the word trauma, we can accidentally be focusing on things we can see, and we miss patterns. So we miss coercion, we miss things that are happening that are silently controlling. We miss the things that are about neglect, ignoring, avoiding, treating someone like they don't exist. And for me, those who've experienced emotional neglect in their childhood will often come to me almost denying their need for care, saying, I must have other people who've had real trauma. I haven't had real trauma. I've never had one of those bad things happen to me. Actually, if we think about childhood, it's the most distressing thing to be left alone. We are herd mammals and we need one another, and we need people. We need to be tuned into the same way an animal might tune into us, just being with us, not doing anything, just communicating acceptance and belonging. And so that injury, I think, gets ignored when we use the word trauma too much.
My association with that is also that there's no trauma hierarchy. Like how your patient said, somebody else needs it more than me, right? And there's the big T, little t, which I think you touched on when you said combat versus non-combat, right? Sexual abuse versus non-sexual abuse. People only think about trauma usually through in that context. And and just to kind of recap, like trauma is whatever dysregulates you in a chronic state that changes like your behaviors, and specifically you were not safe.
Yeah.
Or buffered immediately after.
Yeah. And I think, the other thing about this, if we know where healing is, which is then that I can sense my safety in those spaces, and I've just talked about the external spaces that so far, then that helps us to know what we care about. We care about anything that makes someone feel not safe. And that's me talking as a healer. If I was an insurance writer, I'd need different definitions. And that's really where we need to pick up. DSM is written for them. It's not written for healers. Yeah. And so for healers, I care about anything that is making the other person distressed. And I like the word distress because it instantly reminds us of the body and instantly reminds us of the community around a distressed person.
Yeah, I think I might actually start shifting the word trauma more frequently to distress for that same reason. Yeah, I understood it immediately because it allows people to self-validate, which they can then seek healing without the pain of the ultimatum, right? Which is like, you go to therapy or I'm leaving, right? How many like marriages and relationships, somebody comes into the therapy office for one of those kind of reasons. And in this way, you're allowing people to accept that period of distress and then how it carried on through their life.
Yeah, and look, distress is something we all feel. It also makes us all more on the same journey together. And we have different types of distress and different things that have happened to us, and some of them get more embedded into our memories and leave us with things that cause us flashbacks. But that distress is possible to heal. I think that's the other thing. I'm giving a talk later in the year entitled The Comforted and the Uncomforted. And I guess I would see that one element of sensing that we're safe is feeling comforted in the presence of other people. So the tuning in, the kindness, the presence of someone who can help us hold the distress and contain it in some way because we're not alone. Those who study neurodevelopment talk about the buffering of another person's presence with us when we're in the presence of something that is stressful or stressor. So I guess for me, there's that sense of being part of something bigger than me, belonging to people who learn how to comfort one another. And inside a couple, that's a key element of how we are with one another. I also think of sensing that we're safe as helping us have courage. And so you mentioned agency at the beginning, because when we're with somebody who helps us to feel safe, we then have somewhere safe to step out from to explore the world. And those who know about parenting training, the beautiful circle of security has these elements of I run to be welcomed home and delighted in, and then I step out from that secure base to go and explore and adventure and discover the world with you delighting in me and being there with me on that journey. And so both elements of those are part of safety. We have safe haven where we feel comforted, and safe, secure base to step out from, which gives us courage. And so it's comforted and courageous.
That's like poetic, because I'm thinking of sometimes when I'm like, oh, my kids are so nuts, but really they feel so safe that they just have so much confidence and freedom to, there's like a talk to strangers because you don't, for a different reason. That's a different show. But in this context, the talk to strangers is because they're like, I want to talk to them. They should want to talk to me, right? I had the talk to strangers for a different reason as a child, with the neglect and stuff. And so my reasons were not always
Safe.
built. The foundation there wasn't safety, right? So then I wouldn't be able to protect myself if that other person was not a safe person. You don't always know that immediately. Right?
That's right.
Whereas my kids might go talk to the strangers, but then still they know how to put boundaries in place and not keep themselves safe. They're small kids, but they know when. Yeah, well.
Yeah, and this applies in adulthood as well. So those who study a part of safety, which they call psychological safety in workplaces, they know that people who feel safe at work better in teams, innovate better, create better. And so that idea that when you're feeling safe, you can be more fully yourself. And that's part of that safe enough to be myself, safe enough to express myself. And to express my needs, which those who have suffered neglect never feel safe to do.
Right. Yeah. And I think this might be my first time talking to somebody else so much about safety that also was willing to talk about safety. Because most of the time people, I think, don't even know or have enough language to think about it, let alone talk about it, and then do the next step, which is like critically think through it, educate people about it, right? Because you have to put yourself in a lot of people's shoes to get more language, right? Collect those data points.
Yeah, look, I've been very intentional about making sure it's not jargon. So the phrase sense of safety is just ordinary English. And then I went and checked it. So I checked it with patients, with GPs from around the world, and so by around the world, I mean the Norway, USA, and Australia, with mental health clinicians across different disciplines, and with First Nations leaders. And what came out of it was really more than I had hoped for. When I asked people the question, what does the phrase sense of safety mean to you? Most answers included three elements. They included myself, other people, and my context. And they included watching how I felt in connection with the other person. Did I feel a safe connection with them? And also, did I feel capable in my own context? Did I feel capable to engage? And so out of that came two elements of building sense of safety that is part of the model, which is respectful connection, build safety, and capable engagement, feeling that I can capably engage with my context. But the other thing that came out of it was seeing that sensing that we're safe is this amazing holistic knowing. We sort of integrate, we take into account our own capacity and sensing with our awareness of other people around us, or people we know who support us, or how we perceive that they support us, and with our sense of what's going on in our context and whether we are capable to engage it. And all of those things come together for this central thing of sensing that we're safe. So as a family doctor, I've been I'm chasing ways of making sure we don't leave out parts of the person And I suddenly realized that the word sensation is really central to this idea, because sensing is a very physical thing. You know, we use our eyes and our ears and our bodies and sense of smell and everything to know where we are. And interoception, yes. I talk about 8 kind of ways that we sense the world, including proprioception and interoception, as well as those are normal ways of seeing and knowing. And then it also is sense making at the same time. So it brings in what we know, our history, our understanding, our beliefs, our perceptions, and connects it to what our physical sensing is saying. And together they give us whether or not we can sense that we're safe. And so it's this incredible whole person process that happens when we're sensing our place in the world. And it's a moment by moment thing. It changes, it senses changes in our environment or in our inner life that can affect how safe we feel in the world. And so that's why sense of safety is so central. Those who work with attachment use a very similar phrase. They call felt security, which is our inner feelings of being secure. But I wanted something that was very clearly about the body or our senses, whereas feelings, sometimes people can misinterpret that to be our thoughts. We get muddled up. I didn't want a jargon phrase, which is what I saw that phrase as. And so hence my pursuit of that. And felt security is used within a certain framework of us understanding attachment between people, whereas I wanted something wider that was about how we connected to our world and how we connected to our bodies and our physiology of feeling safe, and so hence that phrase.
What I'm also taking out of this is you're giving people different entry points into themselves. And so depending on if this is your first time listening and thinking about yourself, even as a provider, or maybe you're listening because you think you're listening for a loved one, right? And now some of this is starting to ring true, and now you're starting to kind of look internally. Do I have these feelings? Do I feel safe? And I think for a lot of us, it's a really big eye-opener on how complex something as fundamental as safety is or should be for us as humans, and it's just not. It's not for everybody. And some people live large chunks of their lives never being safe, let alone feeling safe.
Absolutely. So that's partly why I talk about building a sense of safety rather than like recovery or overtly like we've got to go back to where we were before, cure, or those kinds of things.
Okay, wait, so now I'm curious. So when my podcast, I really, really forced the word safety. It had to be in there. And then also you kind of have that trauma, because how else do people find you and know what it's about, right? So when you saw my podcast name, the Trauma Safe Lab, did anything come up for you?
Well, I was just thrilled to see the two words together. And I like the word lab because it's like something's growing. And I have, even though I've mentioned earlier in our talk my hesitations about the word trauma and how it can exclude people or make people feel like they're not worthy of care, I am relieved as a clinician that it's now something we talk about as a community. And in effect, if we translate it to the original Greek word, that our community gets wounded. And wound and care together seem to me go, wound and safety, they go together. And look, I have lived through a time when as you mentioned in my introduction, I set up a transdisciplinary clinic for my patients in 2009, and I closed it in 2013 to go and do further study. And that's when I went off and did my doctoral work. But at that time, it was really, I was an outlier in my community. I got a lot of my learning from people working with children. The adult psychiatric community has been very slow to pick up on how a childhood impacts a life story. And in fact, Vincent Felitti, who did some of the first population study work, he predicted this. He said, we're really not good at noticing when something in childhood affects adulthood because we separate out who cares for adults and children, and the knowledge is not passed.
I have a 10 out of 10 ACE score.
Yeah. And he talks about turning the gold of a childhood into the lead of an adulthood, and how, our community of clinicians are so slow to pick that up. And the other thing he warned about is that we would be slow at picking up physical injuries that are caused by psychological harms. So I guess I would be saying that we as a community need to get better at noticing the patterns across a lifetime. And again, the ACE study has some benefits in that it helps us know the kinds of harms, but they're a very narrow list of harms compared to the ones I see in everyday practice. And they can cause people to feel like that their injury will be ongoing, whereas I really want to give a message of healing. People who previously were thought of as not able to be healed in my workplace, for example, people with a diagnosis of borderline personality disorder, which we all now know is complex trauma in another name. And they were people who were written off in my early training when I was working in emergency departments in the early 90s. And now they would be my main caseload when I was working clinically, which I ceased a couple of years ago. And they're my favorite people to work with because there's so many pathways to healing. And so I guess I would be wanting to speak hope into this story that, yes, we may have not experienced safety in many different ways, but the future is that we can build our sense of safety with the people and environments that we're in and in our bodies and in our inner lives.
And I think I started talking about this recently on podcasts, and I was surprised. I know I'm not the only one that's noticed it, but so far I've not talked to anybody else who has noticed it. So the way I also tell people to think about if you feel safe or the other person feels safe is how spontaneous are they? So I know, like, the more stiff I am, like, even when I'm recording, like, okay, I'm not as loose, I'm not as spontaneous, right? Then I have something else going on, in my body. And I'm sure when you have patients in front of you, whether they're there for a medical condition or something else, you can kind of see the ones that are not, they try to have that more like a sense of control. They don't really let you kind of get too deep. They want to have more of like a scripted way of engaging, right, to put up that protection. And
yeah, I find that the wisdom of Daniel Siegel here really helpful, because he talks about well-being being like being on a river that's moving and flexible and integrated, and it has a flow, and that the banks of the river are rigidity and chaos, and that the health is in the middle of that river, floating down the middle and moving away from either side.
Yeah, I needed to hear that.
Yeah, and I think in our bodies, when we think about our bodies at their best, when they're feeling safe, there's beautiful regulation, like our hormones, our nervous system. I still never cease to get amazed by how amazing human bodies are and how they adapt and regulate. And those of us who've had difficulties in our lives, we've had to adapt to them, and our bodies have been adapting as well. So this sort of respect for our body and how we can help it to feel calm. And even if we're not very good at feeling kindness towards ourselves as a person, we can start by feeling kindness and affection towards our bodies and looking after it, like putting it to bed at a good time of night and giving it music that always makes it feel more settled, and food that is nurturing and kind, warm, and ways of being with our body that are affectionate.
Some communities say mind your own business, but really the opposite of that is like focus on yourself first, right?
Yeah. And I think there's part of what our bodies needs is being with other people, being with animals, with nature, with people in a way that feels settled and safe as much as we can tolerate.
Yeah.
I think the other wisdom is around the window of tolerance for what our body can tolerate. And when we're not well, that window is very narrow of what we can manage. Then when we become well, it widens. But to be actually patient with where we currently are at.
Yes.
So that we don't push what I call the dose of healing too fast. Yeah.
Yeah, I see what you're saying about your wording. Yeah, this is good. You're giving me good practice.
Yeah. The other thing I have just been playing with for myself is the idea that healing is more like play than it is like work.
Oh, yeah, that's true.
Yeah.
That's the way it feels as it's happening. You're like, it feels like a gift to yourself.
Yeah.
Yeah.
I think, I don't know if you've ever seen those kind of games where you sit in an inflated circle and you float down a river. That's kind of what I feel like is what we're saying is like, let's do some of that kind of play. Every now and then you have to get back out onto the bank and live with life as it currently is. But hopefully your time playing in the river will be something that gives your body some rest and recuperation and helps it to settle and what I call calm body. So if we say our goal of treatment, our goal of care is that we would have a calm body, doesn't mean our body's calm all the time, but that it has moments where it can sleep properly. And Stephen Porges has his beautiful pointing out that as mammals, when we're still, we do need to know that we're safe because of the community around us. So for sleep, for sex, for giving, for nurturing babies, we need stillness, but we don't have the capacity to instantly defend ourselves with movement. And so we need our herd around us to be giving us that sense of safety. And if we live alone, I think that's given to us by the city, because the city has the lights and the person who made the door lock for your house door and the person who made the soft sheets that you're, or safe things that you're in your house, the farmer who made the food and the policeman down the road. And hopefully not that all cities are as safe as that, but to say that as humans we do try to give it to one another, the communal safety that makes it possible to lie down to sleep.
Now, when I think about care plans or interdisciplinary plans, safety plans, the new context is not necessarily medicine or something immediate, right? But the ongoing quest to stay like in the river and the flow.
Yeah, and to be able to lay our heads down somewhere genuinely at peace. And for some people where beds have been danger places, then to just say you don't have to sleep in a bed. You can sleep in an upright chair, in one of those, some other place. You can sleep in a different room.
Permission.
We do need to acknowledge that our bodies know if they've experienced something unsafe, they're not going to be trying to sleep in that space, that they're going to be trying to stay vigilant and aware.
So how do different cultural backgrounds influence the way they experience and express safety?
Well, I love those two words you use, experience and express. In Australia, we have the social and emotional wellbeing framework that's developed by our First Nations people, and it has around the edges experiences and expressions. It also has layers around social and historic and structural things that impact safety, and then it has layers of connection around a very communal understanding of self, connection to body, connection to kin, and not just family, but a wider sense of who family is and community and land. So a very deep connection to country, or the place where you have grown and where you belong. And then connection to spirit and ancestors is in the framing of what it is to be well. And so I would say, I think across cultures, there's little differences in how a community communicates safety to one another, but fundamentally there's many, many similarities. And my PhD supervisor was a Dutch woman, and she talked about a different phrase which meant the same thing in Dutch. So it was safe inside my skin is the language that they had. Whereas the Norwegian people that I've spoken to have a different word which they described, which they talked amongst themselves to decide, yes, that's what we mean when we mean sense is the same as English word sense of safety. And so I really do think that there could be other languages, ways of communicating this same phenomenon. Yeah.
I'm gonna search that out now, and I'll give you some, because now that's like my hyperfixation right now.
Yeah, wonderful. I'd love to know more. Please tell me. I'd love to know. It is very subjective, so it's not.
Of course.
And I guess I would be saying that sensing that we're safe is both subjective and objective. It's between us and other people. It's invisible. It's about sensory knowings that are inside us, as well as kind of physical knowings, like is it a safe road to cross kind of thing. And that both matter. I just got a paper published called Sense of Safety as a Theoretical Framework, and in there I suggested that we think of safety 3, which that we talk about in medical workplaces. Safety 1 is that that we don't cause harm. Safety 2 is that we try to make sure things are safe, and I would say safety 3 is that we make things that they sense that they're safe. They can sense that they're safe.
It doesn't matter if they don't sense it, right? So in your book, Sense of Safety, you explain a lot about what it means, but as far as, beyond being just safe from the physical danger, why is this deeper sense of safety so important for overall well-being?
Yeah, so I guess I have become really aware of how we often carry with us a lack of safety on the inside. And I probably came across this most intensely with people who were really able to describe to me what it felt like on the inside when they were survivors of severe trauma. And their descriptions helped me to understand myself and to see patterns in everyday life about how we relate to ourselves on the inside, and that parts of ourselves are really normal. So when I'm deciding to go for a walk in the morning, one part of me sets the alarm. Another part of me in the morning may not want to go for a walk and wants to turn the alarm off. And unless I have internal unity, I can be causing harm by one part trying to control the other part or ignore the other part. Yeah. So if I go for a walk and make myself get up and go for a walk, but one part really wanted to stay in bed, and she says to the other part, "You're so controlling. Why do we always have to do what you want to do? I didn't sleep so well last night. What are you doing dragging me around the streets?" And there's basically an internal little argument going on. Or the other direction, we stay in bed, but the other part's saying, "You're so lazy, you never get up, you never do what we planned, you always sabotage what I planned," blah, 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 those kinds of internal language. Or even what I think is even worse, completely ignoring the desires of the other part and just acting as though they don't exist. Minimizing, ignoring, avoiding, abandoning internally. And so for me, the good news about this is that unlike our relationships with other people, we can't control the other person's reactions or help them to heal or help them to treat us differently, but we can learn how to heal our whole selves on the inside. There's a conversational model of healing that a psychiatrist from Australia designed called Russell Mears, and he has this phrase about how we treat the inner world, which he calls tender, reflective attention. And so that concept of tenderness internally, I would add the word affection there as well, is something that, so therefore we make the decision about getting up to go for a walk after the alarm rings with an affectionate tenderness towards ourselves and a desire for unity, a desire for inclusion and belonging internally. So I would say sensing that we are safe has 3 layers on the inside. It has the layer of sensing that we're safe in our inner experiences. So that can be, yes, it can be thoughts if we're constantly thinking about something particularly frightening or distressing or trying to predict something or worrying about something, or obsessing about something, craving something. Those can be things that are in our inner life. But it can also be flashbacks, what I call memorial experiences. So they're things that have happened in the past that keep on coming back. And they don't necessarily have to have a time zone they came from, as in this happened on X day, like we saw such and such happen, or we heard somebody say those words, or whatever it is. It can be a feeling, a memory of an emotion.
It could even be from your prior life.
Yeah, well, some people would think that, yes. So they of an emotion in our bodies that we don't know why it's here. And I think a lot of suicidal ideation fits into that category.
Yes.
It's usually an early childhood experience of overwhelm where we just wanted to disappear. That experience of just wanting the floor to open up. I just want to not be here, or hide behind the curtains and people can still see my feet, but I'm not here. But unfortunately, in adulthood, it becomes this horrible, nasty thing where we can end our own lives because of a big feeling. And so, again, coming back to that and helping people understand I'm having a memory right now. And there is something on my website called the Dual Process Broad Awareness Protocol. And it's around helping us to remember time has passed, because time changes things and we grow up during that time, and our resources grow during that time. So if we're having flashbacks to an emotional experience in our childhood, but since then we've got car keys that mean we can go somewhere and escape it. We've got friends we could call, we've got money we can use to escape. We've got resources in how we manage ourselves, and we're not totally dependent on people we were with in our childhood.
Mhm.
then our feelings can change as long as we know that we are time traveling, I call it, between the past and the present, and being able to know where we are now and who we are now. Simple things like grabbing our own car keys can make a big difference to knowing, oh, I'm grown up, that's right. Or looking at the size of our feet or our hands to discover, actually, oh yeah, I'm not 6 anymore.
So not just rubbing your fingers in a grounding technique way, or you're wiggling your toes. You're saying, no, literally look at your adult hands. You're not a child anymore. Wow.
That's right. And the other thing is to try and put a date to it. So if I was 6 in, for me, that I was 6 in 74, then you can say in 1974, I had this thing happen. So this is my 1974 feeling. It's now 2025, and it's a long time away from 1974. But just calling it my 1974 feeling puts it in its right.
I like it.
Zone.
Right.
And then
you don't even have to think of the trauma or the event.
No. And then the other thing is you can give it a name. So I had one patient who called hers Oscar the Grouch. So, just if we can make it less serious, more playful, it then makes it less have a control over us. And so we're putting it back in perspective. We're shrinking it back to the right size for our life story and making
control back.
Yeah, so that's our inner experiences. And I want to mention there too that calm body, our emotions are actually situated inside our bodies. And so when we are soothing our body, we are also soothing our emotions. And we can stop having to try and analyze our emotions or figure them out or work out what they will mean. And instead, we can just be saying, what does my body need right now to calm it? And that can be a faster way to soothe that part. It doesn't mean later on we were going to think about why we had that big emotion. But in the moment, we don't need to solve it. And then inside our inner experiences is our sense of self. And so that's where we talked a little bit about how we treat ourselves. And so when I'm talking to someone, I'll often write down the names they call themselves. I'm the littlest one in my family. I'm the one who always is Mr. Fix-It. I'm the one who is stupid, or, different ways they might talk about themselves. And I actually teach to say sorry. If you say something mean about yourself, stop for a moment and just say, I'm so sorry for calling you that name. That's really was a bit unfair of me, or that's not acknowledging how hard you've worked, or that's not noticing how much effort and dedication you put into keeping me safe. Yeah. That's not noticing how much you've carried for me in memories so I could go and learn how to speak and write and be with other people while you held the memory. And then inside that is our spirit and meaning. And so some people, they don't believe in a spirit, and so it'll be meaning making, like how do I make sense of my place in the world? Others have a real sense of spirit, connection to land, to history, to culture, and to something bigger than themselves. And that can be a place of harm. People can receive shame and feel punished and judged and ostracized. And we do have attachment relationships in the spirit space where we can feel the very same things we've experienced with our parents, our physical parents, from our kind of spiritual parents. And so we may need healing there, where we're expecting to be abandoned, for example, or expecting to be punished. And actually, that's not what it really is like in your real relationship in that space. So I'll often ask people, do you feel a sense of comfort in your spirit? Do you feel peace? Is it a place where you can go with your regrets? Is it a place where you feel connected and you belong?
Yeah, because what does the sense of safety feel like? So then you just ask follow-up questions to help them explore it, especially if it's their first time thinking about it.
That's right. And then it can be an inner space of deep safety that can't be changed, is not impacted by other people, is part of our deep sense of who we are.
Yeah, my husband has that.
Yeah. And I also say in that space, it's better to have an unanswered question than a fake answer.
Yeah.
And so to be searching or exploring in that space is a legitimate space as long as you're feeling safe as you do that.
Yeah, I want to say, because I know we're coming up on time and we didn't get through a lot of it. I am having like a hard time staying present. Like I find myself dissociating a little bit. Like I still hear everything you're saying. And I think a large part of it is like, I don't know if I was really ready for safety, like us conversation about safety. And I'm literally so glad that, I met you and you're on the show, and like, there's so much value in it. But two things I want to ask, separately. We figure out when to bring you back on to continue the talk, right? 'Cause for time reasons, we can't do it now. But for another reason, because I would also have to get a little more grounded and settled with what you gave me, because you hit me with a lot.
Yeah, it's many, many layers, isn't it?
Many, many layers.
I think I did sense that as we go, because we're talking to lots of people, aren't we, through this medium of conversation. And I really do want to communicate care to anyone who's listening, especially if you're having strong feelings of not feeling safe. That's partly why I interrupted with some things about grounding, being able to get your keys, look at your feet and your hands, and some other grounding things like touching your fingers together. Feldenkrais rocking is one of my favorites, which is holding onto your thumb and then your other finger and rocking it very gently, backwards and forwards. And then, of course, there's name three things, name three things you can see, three things you can hear, three things you can feel with your body, and actually naming it out loud, because what's happening when you do that is you're helping your brain reconnect to itself. So you've seen the picture on the wall, but then if you say picture, you've had to go to the part of your brain that makes language. You've then had to come to the part of your face that makes words come out of your mouth with motor muscles. And so you're helping your brain reconnect to itself by doing those
Oh my
things.
God, thank you for explaining that to me. I never got the chance to, figure out the why, and that makes so much more sense.
Yeah. The other thing I would be encouraging people to have is things easy to hand. So, do you have a favorite piece of music? Well, make sure it's the first one on your playlist, and you have to just do almost nothing to get to it, and then you can listen. Go through your house. This comes from a book called Coping with Trauma-Related Dissociation, which is a very practical book.
That I obviously need.
Yeah. And it has this thing about going to each room of your house and finding an object which you're going to call your anchor. So it could be the toothbrush in the bathroom, it could be the egg timer in the kitchen, or a soup ladle, and you've chosen it up front when you're feeling calm. And then if you'd feel not calm in that room, you go and look at it, you pick it up, you hold it, you describe it to yourself out loud. How long is it? How heavy is it? How cold is it? What color is it? What shape is it? And all of that is, again, helping you come back into the present, to help your body not have to go back and do a reliving moment somewhere.
The transdisciplinary team, maybe we should talk about that, just because if you don't have personal agency, you don't always know that you need a team, right? Like they say, you need a village to raise a child, but through healing and through trauma and safety, you also need the interdisciplinary team. So what does it mean when you say that?
Yeah, so for me, I set up a clinic where I had art therapy and music therapy, somebody who was good at trauma-informed yoga and attachment in children, and a mental health nurse. And so that people could have easy access down the hallway to somebody who saw the world slightly differently and could help them to play really with how different ways of feeling safe. But that actually was very difficult to maintain, that clinic, because of the funding structures around how we help. But we sometimes had people come in saying, I've got a therapist over here, and they say that I shouldn't be coming to you as well, because I should be only having therapy with them. And I would say, look, actually, for me in my life, my growing has come through multiple different small impacts from different people, and with different lenses, different ways of seeing the world, different pieces of wisdom I could pick up for myself. And so I really don't hold to the idea of just one intense therapy person. And instead, for you to be in charge of how you learn, and it doesn't actually even have to be people you pay. You know, you can go and learn from a poet, or from looking at a painting in an old gallery, or from lying in the park and watching the birds, or becoming super interested in one topic and learning some deep things about how that's happened in the world, or learning about history, all sorts of ways we can learn to grow in our world. And so I would just encourage that sense of a kaleidoscope of learning, and that hopefully over coming years, the health systems will become better at offering us that from within the places we go to get our health care.
Yeah.
But again, I would really want to endorse the expressive arts, and there are people you can approach directly who do art therapy, music therapy, drama therapy, and the sensory motor clinicians who are good at helping us reconnect to our bodies and know what our bodies are trying to tell us. All of those places are really important for us to include in how we get well. And I'd add to that therapy dogs and cats as well, or just pets.
Peacocks or horses or whatever they're bringing on the plane now. Yeah, I also like when I heard that like screaming, like a physical like release, you know, like a release party, you know, like just kind of just, you know, physically like just putting it over there, leaving it over there. I've literally seen it happen in large groups of people, like where it works.
Yeah.
So if you need permission to scream, if you need permission to find multiple, you know, providers, multiple modalities of taking in the information, because you will need actually interdisciplinary, right? It's not ever just going to happen just through one person or one system or one way. Receiving and giving too. So yeah, it is a kaleidoscope.
Yeah, and I would really want to encourage your readers, as I do need to go now, that their journey is their journey, and that we have sometimes made ordinary human comforting and healing into something that has to happen with professionals, when actually it's about humans being together. And some humans are trained professionally so they can do that better. They're more able to hold other people's pain, and especially intense pain, but to not discard the joy of laughing with friends, or going dancing on the beach, or watching a sunrise come up, or
like it's not a selfish pleasure. It could actually be part of your healing, and to like embrace it, run towards it, even allow it to happen.
Yeah, and I often joke that if I could change one thing about public health, it would be that we would do more dancing, because dancing brings in both top-down and bottom-up healing. So top-down, the lyrics of a song; bottom-up, rhythm of the beat and the music, and then right and left sides of our bodies moving, and then socializing safely with kind of human constraints around it that make it safe to be with other people. All of those things, I think, can be said about dancing. So I wish you all lots more dancing, and I look forward to talking to you again, Jennifer.
Thank you, Dr. Lynch, and thanks for being on the show.